Let's talk about countertransference. Now remember, with transference, that's when the client has a reaction towards the therapist. With countertransference, counselors also have emotional reactions to their clients. Countertransference, then, is any projection by a counselor that can potentially get in the way of helping a client. For example, if you've got a client that reminds you of one of your children, you would treat them like they were your child, giving advice, maybe being overprotective. Ethically, counselors are expected to deal with these reactions in some form of a supervision or consultation so that their problem doesn't become the client's problem. Countertransference can be constructive or destructive in the therapeutic relationship. A destructive pattern would be when a counselor's own needs or unresolved personal conflicts become entangled in the therapeutic relationship, destroying objectivity. An example of this would be, one time I was reviewing a tape of one of my students who was in a counseling session. I noticed that the client kept bringing up issues about his father. He wanted to work on issues with his father. The counselor kept diverting him away from that topic, moving him and guiding him in another direction. The client would stay there for a while and then would again come back and want to talk about his dad. The counselor once again diverted him off in another direction. As we were reviewing the tape together, I pointed that out to him and I asked him, I'm like, what's going on here? Your client clearly wanted to discuss some issues he had with his father, and you kept moving him off in another direction and wouldn't let him go there. And the student counselor said, oh my gosh, I didn't even realize I was doing that. He said, I've got so many unresolved issues with my father, and it was just an uncomfortable subject for me. That is a good example of how your own issues can interfere with the progress of your clients. And another good example of why supervision is so important, because your supervisor can point out things that you just didn't even realize. There are some ethical implications that can come out of countertransference. One of them is being overprotective with a client. Counselor's unresolved conflicts can lead him or her to steer a client away from those that are open up in the counselor's painful material. They want to protect clients from experiencing pain and anxiety, but it can thwart clients' progress. They may learn to avoid conflicts. Treating clients in benign ways. Counselors sometimes fear anger, so in order to treat them in a benign way, it creates a bland counseling atmosphere. Superficial exchanges, not really getting into feelings or real emotions that the client may be dealing with. Rejecting a client. The counselor's perception of the client is needy or dependent. So the counselor remains aloof and cool and stays distant and unknown. Needing constant reinforcement and approval. Some counselors may have a need to be reassured of their effectiveness. They expect instant positive results, or the counselor becomes discouraged and anxious, has a lot of self-doubt. Seeing yourself in your client. It's okay to identify with a client, but don't lose objectivity. Don't get lost in their world. Don't dislike the client what you dislike in yourself. Developing sexual or romantic feelings. This exploits the vulnerable position of the client. Liking clients doesn't mean you can't help them. If the counselor becomes attracted, it doesn't necessarily mean that it can harm the therapeutic relationship. It's how it's handled. You really need to consult with the supervisor. And we're going to talk a little bit about more about this issue later on. compulsively giving advice. It can be encouraged by clients who want immediate answers to ease their suffering. Giving advice puts counselors into a superior, know-all position, assuming that they have all the answers for the client. This can sometimes lead to excessive self-disclosure. Well, how I solved this problem was I did this and this and this. What if that's not how your client needs to solve the problem? What if there are cultural issues involved? You have to be really careful about that. Desiring a social relationship with clients. This could cause problems in the therapeutic relationship, lead to dual relationships, and can become an ethical concern. In the 9th edition of your book, they've added a section called Effective Management of Countertransference. And they suggest that clinicians who recognize the patterns of countertransference can easily manage these patterns by monitoring their feelings and use their responses as a source of understanding clients and helping clients to understand themselves. Gain some self-understanding and establish appropriate boundaries with clients. It's fundamental to managing and effectively using their countertransference reactions. Personal therapy and clinical supervision can be especially helpful to counselors in understanding how their internal reactions have influenced the therapy process and how to use these countertransference reactions to help or assist clients instead of hurt them. Client dependence. Clients should move forward with increased autonomy and interdependence. Now, initially, temporary dependence isn't always a bad thing. You know, sometimes clients come in to treatment pretty vulnerable and you might be their lifeline, but you have to remember that your job is to empower them so that they can function on their own. The ethical issue arises when the counselor encourages dependence. This may do the counselor might do this for a number of reasons. One of them might be that they don't want to lose a client. They don't want to challenge a client who shows up regularly and pays on time. They have a need to feel important. Creating dependence it's an ethical issue. An example of doing that may be giving out your cell phone numbers, your home phone numbers, letting them be in touch with you at all hours of the day and night. This is really grandiose. It makes it look like that you are a critical and essential component in your client's life. This is communicating to your client that they're not able to function on their own. It discourages empowerment, and really it's just feeling your need to be needed. Some counselors have difficulty letting go of their clients. It seems unethical when the client is not terminated because of the counselor's emotional or financial needs. This issue rests on the honesty and the goodwill of the counselor. The ultimate sign of an effective therapist, now listen to this, the ultimate sign of an effective counselor is the ability to help clients reach a stage of autonomy wherein they no longer need a therapist. This chapter really focuses on self-care. While I was reviewing it, it really helped me to see as a supervisor some of the stress or burnout signs in my own counselors so that I can take a look at what we need to do to keep them healthy and effective in their profession. Working with people opens up personal themes in a counselor's life, and it can trigger sympathetic pain because we do show a lot of empathy. We have sympathetic pain to what the client is going through, or it can even in fact activate our own painful memories. Sometimes our own unfinished business is often stirred up. Often pain connects with pain. Counselors sometimes become overburdened with stress, and this all leads to burnout. So I want you to be really familiar with signs of burnout because this is a difficult profession, and you really need to take good care of yourself. Signs of burnout: irritability and emotional exhaustion, feelings of isolation, abuse of alcohol or drugs, reduced personal effectiveness, indecisiveness, compulsive work patterns, drastic changes in behavior. Take a look at page 59. It provides some questions you can honestly ask yourself to determine what stress level you're at. Some sources of stress have been identified by research. Some of these are the most stressful situations for counselors. Actually, suicide statements were the very most stressful, but other occupational hazards, economic uncertainty, professional conflicts, time pressure, that sense of enormous responsibility, an excessive workload, managed care systems that you have to deal with, along with all the documentation, educational systems. Most stressful client behaviors for counselors. There's been a lot of research done on what is the most stressful client behaviors when therapists work with their clients. I've got a couple of them that I reviewed, and it was really interesting because in Dutch's findings, the number one thing that was most stressful for counselors was suicidal statements from their clients. Number two was anger towards the counselor. Number three was severely depressed patients. And number four was apathy or lack of motivation. Another stressful thing was the client's premature termination, leaving before the counselor knew they were ready. Farber's findings, now compare these with Dutch's findings. Suicidal statements was number one. Aggression and hostility was number two. Premature termination of therapy was number three. Agitated anxiety was number four. Apathy and depression. So a lot of these variables were in both findings as the top 4 or 5. A few of them in Farber's were in a little bit different order. Burnout, when not recognized and dealt with, can lead to impairment, which can become an ethical issue. Impairment is the presence of an illness or severe psychological depletion that is likely to block a professional from being able to deliver effective services and results in consistently functioning below acceptable practice standards. Counselors that are unable to cope with stressful events and unable to adequately carry out their professional duties are not helping their clients. It can lead to factors such as substance abuse, physical illness, and definitely burnout. Sexually exploited behaviors by counselors is a sign of impairment. They often show these characteristics. The counselor has a fragile self-esteem, difficulty establish intimacy in their own personal lives, professional isolation, and need